Hi, I'm Dr. Priyanka Reddy. I'm a fertility consultant from Motherhood Hospital, Fertility and IVF Department, HRBR Layout, Bangalore. I think the dream to become a doctor started at a very young age. Probably I was 12, 13 years old when I was probably in my 7th or 8th grade when I met few doctors for some certain reasons, and that's when my journey started. And back in school we would also have these coupons which they would give us to go to a bookstore and pick up books that you would wish to buy at a local Bangalore store. So I think one of the main reasons I went there was when I saw this unit which had about the human body, and that interest started growing there. And I think I picked up, first book that I picked up was about a circulatory system, and that was something that was not covered, that was too early at that point, but then I started reading about it. And the friends during my time would probably pick up comics and other kind of books. I really had some kind of interest during that time for these things. So then I went ahead and picked up that book, and that's when it started probably. I wouldn't say a particular person or something inspired me. It was some kind of an interest that I had towards medicine, and that slowly grew. And by the time I was 10th, I think I was pretty sure that I wanted to go ahead and become a doctor. Then I started working towards that goal. Okay, the most rewarding part about being a doctor, I think, would be, for me as a fertility specialist, would probably, yes, I agree that we have success rates. When we see that the patient goes back home with a smile when they are when they have conceived, and or maybe when they take back the baby home. I think that, keeping that aside, I would also say that just giving them the hope that they can conceive, because most of the patients who come to us don't really have that hope. They've probably been to multiple doctors. By the time they come to us, they've lost that hope, and they just want to hear that one word from you that yes, it is possible. And just to give them that hope, and when they go back home, and I have seen many patients when they come back for their second consult, they tell me that, doctor, after the first consult we had that feel that yes, we could do it, we probably are in the right path. So I think that itself is very rewarding for us. But there's one particular patient that I still remember. I think she was somewhere around 35, 36, had multiple failures elsewhere, been to many hospitals. So when she came to me, there's nothing much that I could offer. I didn't have much on my plate. Everything was done. So the patient went ahead with the treatment. She always came in with a smile. I've never seen her, coming and crying, cribbing to me, saying that, you're taking too much time or this is not happening. I think we cancelled multiple cycles, and finally I think we hardly had a couple of embryos. We took almost about 6 months post the egg pickup. We took almost 6 months when we kept cancelling, and she kept coming in and out of the hospital. Not once did she cry or say that, why are you calling me again and why is it not happening, or it was never like that. And she knew she's had many past failures. So finally went ahead and did the treatment, and I told her we're going to keep it simple. I'm not going to try anything fancy because you've done all that is required. She conceived, and I think the day her beta HCG was due, most of my staff already knew that that day the result is going to be out, and all of us were anticipating what's going to happen because we know her history. When that came positive, I think my hope increased. It's not the patients. I think my hope towards my other patients that yes, it is possible in spite of having so many failures. And I think keeping the right attitude was very important at that point, and I think that's what she really taught me.